A 35-year-old male presents with shoulder pain. I am showing you the radiograph of the shoulder. Describe the findings.
Okay, I see it. The radiograph of the shoulder demonstrates generalized osteopenia with marked thinning of the cortices. There is a transverse fracture at the medial third of the clavicle. This is likely an insufficiency fracture, as there are also transverse lucent clefts with sclerotic margins, representing looser zones at the lateral aspect of the clavicle and the lateral border of the scapular body. The combination of generalized osteopenia, cortical thinning, scapular looser zones, and a clavicular insufficiency fracture is highly consistent with a diagnosis of osteomalacia.
What is the pathophysiology of osteomalacia, and what are its key radiological features?
Okay. Osteomalacia is a metabolic bone disease characterized by deficient mineralization of the osteoid matrix in mature bone, leading to bone softening. The primary etiologies are dietary vitamin D deficiency, malabsorption, or abnormal vitamin D metabolism, often associated with chronic renal failure. The key radiological features include generalized osteopenia, cortical thinning, bowing of long bones, protrusio acetabulae, a coarsened trabecular pattern, insufficiency fractures, and pathognomonic looser zones, also known as pseudofractures, which typically occur in the pelvis, femoral necks, and scapulae.
I am showing you two comparison radiographs, one of the hands and one of the pelvis. Describe their findings.
The radiograph of both hands demonstrates a diffusely coarsened trabecular pattern, typical of osteomalacia. The antero-posterior pelvic radiograph shows bilateral looser zones in the femoral necks, appearing as narrow transverse lucent clefts with sclerotic margins. There is also generalized osteopenia of the pelvis and proximal femora. These findings further support the diagnosis of osteomalacia and illustrate the characteristic locations of pseudofractures in weight-bearing and stress-bearing areas of the skeleton.
What other radiological clues should you look for in these patients, and what is the differential diagnosis?
Since osteomalacia is frequently related to chronic renal failure and secondary hyperparathyroidism, we should search for evidence of renal replacement therapy. Look for a peritoneal dialysis catheter or a tunneled femoral hemodialysis line on abdominal films, and a central hemodialysis line on chest radiographs. Additionally, we may see resorption of the lateral clavicles, prominent vascular or soft tissue calcification, and brown tumors, which appear as lytic bone lesions. The differential diagnosis for generalized osteopenia includes osteoporosis and hyperparathyroidism.
How would you manage this patient as a radiologist?
In that case, as a radiologist, I would recommend comparing these radiographs with prior imaging to evaluate the progression of osteopenia and fractures. I would suggest obtaining a non-contrast CT scan of the pelvis and femora if the looser zones are equivocal, or to assess for occult fracture extension. I would also recommend correlation with serum biochemistries, including calcium, phosphate, alkaline phosphatase, parathyroid hormone, and vitamin D levels. I would communicate the insufficiency fracture to the referring team and recommend referral to endocrinology or metabolic bone specialists for vitamin D and calcium replacement therapy.